My name is Harris Rittenberg. I grew up in Charleston, South Carolina. I went to the University of Florida, which changed the trajectory of my life. I went back to dental school at the Medical University of South Carolina and began practicing down in South Florida, where I met my wife, who's from Jacksonville. So we ended up here in Jacksonville, started the practice here in 1986 with her, and love being a dentist, so that's a big part of who I am. I was inspired by my father, who is a physician. So I liked the medical environment and taking care of patients and stuff like that. And all his friends were dentists. And I had the privilege of being able, as a teenager, to observe in their offices. As a matter of fact, my high school annual, people were saying, "Harris, can't wait for you to come back to be my dentist." A little early, but I just always known. I loved working with my hands. People were healthy, and the relationships that you can build over a lifetime with people, just seeing them regularly, a couple times a year, is really, really fulfilling. And it's been a great career, and I'm happy I chose it. When I first started in dentistry, all the focus was save the teeth. You really looked at the teeth a lot. But over the years, all the research has shown things like periodontal disease affects your heart and diabetes and all these connections. So we've really had to grow to be like physicians of the mouth, so to speak. We check carefully for oral cancer, for example. And patients are more aware of that too. They're tuned in more to the holistic part. So we still want to save teeth, because nutrition is important in chewing and that part of the health, but it has changed a lot. Philosophically, we're trying to strike a balance between being conservative and not looking for things to do no harm. If it ain't broke, don't fix it. That's over here. And then the other part is being proactive and being preventive. And so you're constantly weighing that out. You want to really strike that right balance where you're preventing problems but not trying to recreate the wheel. And I think we're good at that. And the goal is for everybody to be comfortable, have a nice smile, be healthy. So back to the health. So that's really important.